Today I wanted to just discuss with you some of the pitfalls and problems that can happen in relation to breast augmentation surgery with implants and fat, which is called a hybrid augmentation. The main things that we need to worry about are, of course, the implant complications themselves, the ruptures, the capsular contractures, the position problems, the double bubble, the rippling, and so forth. There's a whole range of these things. Most of them are extremely rare these days. And we'll cover those with you in your consultation. But because we're adding fat grafting to the operation, albeit a small amount, we do still need to be aware of the potential problems that can happen with that. And this can be separated into donor side problems to recipient side problems. The donor side is where you take the fat, so you do some liposuction, and this is related to liposuction related complications, most of these which are extremely minor. But the main thing that we want to be careful about is not taking too much from one place and therefore creating asymmetry or divots or holes and so forth that can be difficult to fix later. We want to take a small amount from a wider area, and this typically avoids this problem. When we inject the fat into the breast, there are issues related to the recipient side, and the most severe and the most, I guess, one that we need to worry about the most is called fat embolus. This is when, if fat is injected into a blood vessel, it can travel to an organ such as heart or blood or brain and cause a serious complication. Luckily, this is an extremely rare complication in the breast itself. In fact, I've almost never heard of this happening. It is more common in other parts of the body, for instance, in the Brazilian butt lift procedure, which is the reason I don't offer this operation. The risks are just too high. But in the breast, it's extremely rare, and we can be using this technique very safely. But other things can happen, and these things include things like fat necrosis or oil cysts that can form if too much fat is put into one spot without good blood supply, and that's probably the main one that we want to avoid. Typically you'll see some bruising where the fat was injected. That's pretty normal, and that will resolve in a couple of weeks post-surgery. In terms of recovery following this operation, the recovery is very similar to breast augmentation alone, with the addition obviously of donor side morbidity, which doesn't really add too much to it, and most patients are up and about in a similar time frame and fashion.